Imagine trusting your life to a doctor's hands, only to wake up to a nightmare you never signed up for. From scalpels left inside bodies to limbs chopped off by mistake, these medical blunders are so shocking, they'll leave you questioning everything about modern medicine. Buckle up. We're diving into jaw-dropping cases where routine procedures turned into unimaginable horrors. You won't believe what went wrong. The broken hip and broken trust. Arlene Windsor, a 50-year-old woman who had led an active life, found herself facing a fractured hip, a painful but manageable injury that she assumed would heal with the right care. She placed her faith in her medical team, expecting a straightforward hip replacement that would get her back on her feet. An X-ray laid bare the severity of the break, and her surgeon sketched out a plan that seemed routine enough. After all, joint replacements are performed thousands of times a year with success. But the operating room became a stage for a series of devastating missteps that would rob her of everything. The X-ray technician assigned that day was green, fumbling through the process and struggling to produce clear images after multiple attempts, each blurry shot a missed chance to guide the surgeon properly. Growing impatient, the surgeon dismissed the technician entirely and made a fateful decision to proceed without the crucial visual aid, a choice that defied basic protocol. With no clear map, he drove a metal spike into the wrong section of her bone, accidentally slicing through her sciatic nerve, one of the largest and most sensitive nerves in the human body, responsible for leg movement and sensation. When Arlene awoke, she wasn't greeted with relief but with excruciating, relentless pain that radiated through her body, a torment that no amount of medication could dull. For 2 agonizing months she endured this suffering, only to face a second surgery, meant to repair the damage, a procedure botched by an inexperienced intern who somehow made the nerve damage even worse. Now confined to a wheelchair, her once independent life crumbled. She couldn't walk, couldn't escape the pain, and couldn't see a future beyond her despair. The weight of it all became unbearable, and tragically, Arlene took her own life, a heartbreaking end to a story that began with a simple fall. This wasn't just a medical failure, it was a betrayal of trust, born from an untrained technician, an arrogant surgeon, and a system that failed to catch the mistakes before they spiraled into a fatal chain reaction. Forgotten surgical objects. It's the stuff of nightmares. A surgeon stitching you up, only to leave a piece of their toolkit behind inside your body. You might assume this is a freak occurrence, a 1 in a million mishap, but the reality is far more unsettling. Thousands of surgical instruments are left inside patients every year, turning operating tables into ticking time bombs. With each surgery requiring dozens, if not hundreds, of tools, sponges, scalpels, clamps, needles, the chaos of the moment can make it shockingly easy for something to slip through the cracks. In many cases, soft items like sponges go unnoticed for years, quietly nestled in a patient's abdomen with no immediate signs of trouble. But when it's something sharp, a scalpel blade, a needle, or a metal clamp, the consequences can be immediate and catastrophic. These forgotten objects can migrate through the body over time, slicing into vital organs, triggering massive infections, or causing unbearable pain that defies explanation. Dirk Schroeder learned this the hard way after what should have been a standard prostate surgery. Months later, his worsening condition led to a horrifying discovery. 16 surgical objects, including needles, a face mask, and a scalpel, had been left inside him, turning his recovery into a prolonged battle for survival. It took 2 additional surgeries to remove them, each one a grueling ordeal that tested his endurance and faith in medicine. Another case saw a woman suffer severe cramping after uterine surgery, dismissed as normal recovery woes, until days later she expelled a surgical glove, 5 cloth compresses, and a pool of blood, a grotesque delivery that no one could have prepared for. In England, a similar story unfolded when a woman's post-surgery pain revealed a forgotten glove festering inside her. These terrifying incidents aren't isolated. They're a stark reminder that even in our high-tech era, human error can transform a healing process into a life-threatening ordeal, leaving patients to pay the price for oversight in the operating room. Growth hormone tragedy. Pituitary dwarfism is a condition that halts growth in childhood, leaving those affected with unusually short stature due to a lack of natural growth hormone, a challenge medicine has long sought to address. Today, synthetic hormones provide a safe solution, but rewind to the years before 1985, and the treatment was far more macabre. Doctors extracted growth hormone from the pituitary glands of human corpses, harvested from organ donors in a practice that sounds like something out of a Gothic tale. One group, France Hippopotamus, founded in 1973, led this effort, distributing the hormone worldwide to help children grow. It worked, until it didn't. In 1983, they expanded their sourcing to hospitals in Bulgaria and Hungary, where financial incentives lured staff into providing fresh glands with little regard for safety checks. The result was a disaster waiting to happen. Many of these glands came from donors who had died of neurological diseases, including the deadly Creutzfeldt-Jakob disease, CJD, a rare brain disorder akin to mad cow disease that destroys cognition and mobility. Children injected with these contaminated hormones unknowingly carried a death sentence, the disease lying dormant for years with a long incubation period. When symptoms finally struck, confusion, tremors, rapid decline, most died within 6 months, often from complications like pneumonia, their young lives cut short by a treatment meant to save them. The link to CJD was confirmed in 1985, prompting a global shift to synthetic hormones, but France Hippopotamus ignored the warnings, continuing the practice until at least 1990. Officials waved off concerns, suggesting the alerts were just a ploy to push newer drugs, a decision driven by denial and profit that cost countless lives. This haunting chapter in medical history stands as a chilling testament to what happens when caution is sacrificed on the altar of convenience. The tragic thalidomide scandal. In 1957, a new drug called Contergan burst onto the scene in West Germany, marketed as a miracle cure for everything from coughs and insomnia to nausea, a one-stop remedy that promised relief without risk. It quickly gained a following among pregnant women who embraced it as a godsend for morning sickness. Sold under names like Distaval in the UK, Australia, and New Zealand, with bold ads touting its safety for both mother and baby. But beneath the glossy assurances lay a nightmare that wouldn't surface until years later, when the true cost of this wonder drug became impossible to ignore. By 1961, doctors began noticing a disturbing trend. Babies were being born with missing or severely deformed limbs, arms and legs reduced to stubs, or suffering from brain damage that left them struggling to survive. Tragically, 40% of these children died either in the womb or shortly after birth, their brief lives marked by suffering no parent could foresee. As alarm bells rang, Australian Dr. William McBride stepped forward with damning evidence, publishing findings that pinned the blame squarely on thalidomide, the drug's active ingredient. Yet the manufacturer, Chemie Grunenthal, didn't back down. They doubled down, hiring private investigators to discredit whistleblowers and keep the drug on shelves. It wasn't until late 1961 that thalidomide was finally pulled from most markets, but the damage was done. Thousands of families were left shattered, grappling with loss or lifelong care for disabled children. Shockingly, a sister company in Spain kept selling it into the 1980s, instructing distributors to stay mum about the risks, prolonging the tragedy for profit. To this day, survivors in Spain and beyond bear the scars of this medical betrayal, their lives a testament to the devastation wrought when corporate greed overshadows patient safety, a chapter in history that demands we never forget. A comedy of medical errors, Blake Vaughn, a young man from Blacksburg, Virginia, walked into the hospital with the kind of optimism you'd expect from someone nearing the end of a medical journey, ready to leave his treatment behind and step back into life. He'd been through the hard part, or so he thought, and as he prepared to be discharged, All that remained was the routine task of removing his IV line, a procedure so basic it barely registers as a risk. But that day, the hospital handed the job to a nurse with no experience in the task, a decision that would prove fatal in its simplicity. As she fumbled with the line, an air bubble slipped into his bloodstream, a tiny, invisible intruder that turned deadly within moments. Blake began gasping for air, his chest tightening as the bubble raced through his veins, triggering a catastrophic complication. His parents stood by, helpless and horrified, watching their son collapse before their eyes, his life slipping away in a scene they'd never unsee. The hospital later acknowledged their negligence, admitting the oversight that cost a young man everything, but no apology could rewind the clock. In a darkly ironic twist, another case under this grim banner saw a young woman head in for a routine appendectomy, only to wake up to a nightmare. Surgeons had removed her healthy kidney instead, thanks to a mislabeled chart that scrambled her fate. She now faces a lifetime of complications, her trust in medicine shattered by a mistake that should have been caught. These stories, dubbed a comedy of errors with bitter sarcasm, reveal a sobering truth. Even the smallest medical tasks demand precision and training because when they go wrong, the fallout isn't funny, it's heartbreakingly final.